Hey there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Facebook Live with Integrative Movement Insider. And this is a four-part series on the hip complex, and more specifically, using the gluteal complex and activating the glutes in your clients that have low back, hip, and even knee and lower extremity issues. I apologize for the lighting and the sound. I'm here in Santa Barbara. Janice and I are here in Santa Barbara, California. It's not great, such a beautiful day. However, it's a great time and opportunity here to share this with you before we go into our coaching session. One of the most important things that we stress in our own lives and that we adhere to is getting coaching. So we just talked about recently the release, or I should say the opening pre-registration of our Integrative Movement Specialist Certification coaching program, and that we're taking applications right now for the fall 2018. And one of the most important things that you can do this year, right now, to accelerate your career, to have better impact, make greater income, and really create that ideal business that you want, is to get coaching. Janice and I have gotten coaching from the time we started in our careers over 20 years ago now, improving our skills, improving our mindset, and now in the last 2 years we've really focused on business skills. Because again, most of us got into this industry, you and I got into this industry to help clients, to help our patients, to help individuals live better lives. Part of that is we work so much on our skills and helping our clients and paying so much attention to developing our skill sets that we sometimes forget that we're also business owners, and we need to also improve and work on our mindset so that we can be in a great place to help serve our clients and help deliver excellent, extraordinary results for them, which we do every single day. So one of the best things that we can do, you and I can do as health and fitness professionals, is to get coaching, to take our own advice and get coaching. So we're out here at a 2-day business coaching with our mastermind group, so we're very excited to be part of that group of high-level, high achievers, and to learn from them, to grow with them, and to share this experience of what works, what doesn't work, so really the best practices. And that's what we're sharing with you as part of the Integrative Movement Insider series, is we share with you best practices usually around developing your skill set. So without further ado, let's turn our attention to this series information. And we're talking about the glute complex. And this comes in relationship to a patient I worked with last week, John. John's an awesome guy. He came to me about a year ago, a little less than a year ago, with chronic hip issues. And he's like, yeah, I'm getting this groin pain in front side of my hip, and it's really impacting my ability to play tennis and exercise at the levels that I want to. So after evaluation, I said to John, I'm like, yeah, you definitely have a lot of limitations in your range of motion, especially internal rotation, as well as adduction. A lot of pain when we put him into the impingement position for his hip. So I sent him out for an x-ray, and it turned out, as I suspected, he had quite a bit of degenerative changes in his hip. So we did our best. We worked with him for about 4 to 6 months, and I said to him, we're gonna do our best with what we have. So I helped him develop better alignment, breathing, and control, the principles of the integrative movement system, and he was able to maintain relative good alignment and control and improve some of his movement patterns, but he still couldn't get back to tennis over the activities of everyday life, like walking. Like, he loved to walk with his wife and his daughters, so he couldn't get back to that level. So we talked about it, we discussed it, we had a conversation about it, and we finally decided that to get to the level he wants to get to and return to tennis and the activity level he wants, he needed a hip replacement. However, once he was done with his initial rehab after the hip replacement, and it was a successful hip replacement, and now he's back on track to doing the things he needs to and wants to, he's actually back to playing tennis now. He came back to my office last week, and he's like, hey, I'm feeling really great. The one thing I would say is my left hip, the hip replacement side, still feels a little bit weaker than the right side. So his trainer had him do a single leg bench squat. So that's basically where you just stand on a single leg and you squat back to a bench. The challenge with the pattern as John was doing it is he was just squatting and just collapsing into the bench, like so many of our clients. So he's going into posterior pelvic tilt, and he really wasn't controlling his hip and pelvis. So therefore he wasn't using his glute in the right manner, and he was actually creating rotation around his knee. And as I pointed that to him, I actually recorded it on his phone and showed him. I said, John, look at your knee, look at your hip. You're not actually controlling your hip as you need to. So what he said is like, oh yeah, it's interesting you say that, because I've also been experiencing some knee pain, and I thought it was just as part of working out. So one of the things we want to do in this series of Integrative Movement Insider is share with you some of the strategies that we use with our own clients and patients, and things you want to pay attention to with your own clients. Because a lot of our clients are doing these high-level exercises like single-leg bench squats, even though that may not be the highest level pattern for some of your clients, but they're doing exercises on single leg, they're doing reaches, they're doing single-leg deadlift type patterns. However, they're not really set up for success. And what happens when they're not set up for success is they just reinforce their non-optimal and inefficient habits that created the problems in the first place. Maybe their tightness, discomfort, and or the inability to perform at the levels they need to and or want to. So in this series, I want to share with you some of the strategies and cues we use with our own clients. And today, we're going to address the first strategy, oftentimes, the most important strategy for our clients with hip, low back, and knee issues. And that's the number one reason why our clients have issues in the first place, and it's not a weakness. Most of our clients don't have weak glutes. Yes, they could use stronger glutes, but it's not because of weak glutes. It's because they're using a non-optimal and inefficient strategy for accessing their glutes. More specifically, our industry, I was taught this exact same thing, our industry focuses on concentric strengthening. So we've been taught to have our clients squeeze their glutes at the top of every single exercise. Lunges, bridges, squats, deadlifts, every single pattern we do, we've been taught to squeeze and drive the pelvis into a posterior pelvic tilt. Because we thought that the anterior pelvic tilt, we've been taught that the anterior pelvic tilt is such a bad position for the back. And just like any position, yes, you can get too much into anterior pelvic tilted position, but for the majority of our clients, especially our older clients, baby boomers and seniors, clients that are about 50 years of age and older, very few of them, if any of them, are in excessive anterior pelvic tilt, let alone anterior pelvic tilt position in the first place. So they're already coming to us in posterior pelvic tilt because one of the things that causes posterior pelvic tilt is, number one, they cue themselves by pulling their abs in, squeezing their butt. They pull themselves into posterior pelvic tilt. They sit too much, so they're already living most of their lives in posterior pelvic tilted positions. And they're also taught when they exercise to squeeze their glutes and drive themselves into posterior pelvic tilt. And what happens is they don't have a lack of concentric strength. They don't have an inability to squeeze their glutes and pull themselves into posterior pelvic tilt because that's what they do all day long and through all their exercises. What they have trouble doing, what really creates most hip issues, low back issues, and lower extremity issues around the glutes is they don't know how to eccentrically lengthen their glutes, posterior hip complex, hamstrings. So the muscles of the posterior hip complex include glutes, hamstrings, as well as the calves and gastroc. They have an inability to really eccentrically lengthen those muscles to create the proper hip hinging type pattern that you need for a deadlift pattern, that you need for squatting. So if you're squatting, you need to create the eccentric lengthening around the posterior hip rotators, the external hip rotators, the glutes, and the hamstrings to create the ability to get that pelvis to move anteriorly over top the femoral heads. So whether you're squatting, lunging, deadlifting, stepping even, you need that ability to lengthen and let go of the glutes, the posterior external hip rotators, and the hamstrings to get the pelvis and the entire thoracopelvic cylinder, so the thorax and the pelvis, to move anteriorly over top the femoral heads. Most of the clients, I should say, you can never say ever, always, and never. You want to say most clients that I see in my clinic that have hip issues, low back issues, and or knee issues, they don't get enough anterior pelvic rotation or rotation of the pelvis over top the femoral heads. So the number one strategy we need to teach our clients is to release the posterior hip complex, let go of the glutes. It doesn't mean like let go like they're not using, but allow the pelvis to move anteriorly. Allow the hamstrings to lengthen, allow the hip rotators to relax so that the client can move their pelvis anteriorly to load up the posterior chain effectively and optimally, so that way you can use them concentrically effectively. We can't just train, we don't want to just train concentric function and teach our clients how to stay in posterior pelvic tilt. We want to teach them how to get anterior pelvic rotation so that they can load appropriately, so that way they can use their glutes, hamstrings, and posterior hip rotators effectively during the concentric phase of the exercise. So again, most of our clients do not have a concentric problem with their glutes. They have an eccentric problem, meaning they need to learn how to eccentrically lengthen the glutes, hamstrings, external hip rotators so that they can properly use them during the concentric phase, and then they don't have to be taught to squeeze and contract and brace and grip as tightly as they can, and they will actually have better functioning glutes, and what most of our clients want are better looking glutes as well. So This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education, sharing with you some of the strategies that we use with our own clients and patients in our office. So this is part one. On Thursday, I'll be back with part two, showing you how we use a very common corrective exercise strategy to further reinforce this idea of eccentrically lengthening the glutes, as well as the external hip rotators and hamstrings, so that way you improve function of the hips, low back, as well as lower extremity. And again, Janice and I are about to get off to our coaching session today. And if you're looking for a coach and you would like us to be your coach, sign up for the Integrative Movement Specialist Certification Coaching Program that begins this fall. We only take 20 individuals in each class, so that way you get hands-on, you get attention, you get the skill set, you develop the mindset, you develop the information that will help you succeed in this industry, further succeed, I should say, take your skill level to another level and really attract more of those individuals that need, want, and will pay you for your expertise. Thanks for watching. We'll catch you Thursday, and we'll also be bringing you information throughout our coaching sessions, so some of the best practices, so that way you can also succeed in business. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Take care, make it a great day.